As we grow older, maintaining personal hygiene becomes far more significant than simply looking presentable or feeling fresh. It becomes a vital foundation for safeguarding our health, preserving our independence, and protecting our quality of life. Good hygiene habits can mean the difference between living vibrantly and facing preventable illnesses that rob you of your freedom and dignity. Yet, what many people don't realize is that seniors often make small, seemingly harmless hygiene mistakes every single day. Mistakes that aren't just minor oversights or cosmetic concerns, but can silently open the door to serious, even life-threatening health issues. Decades of research from some of the world's leading medical institutions, including the Mayo Clinic, Harvard Medical School, and Johns Hopkins University, have consistently shown that poor hygiene practices among older adults are directly linked to an increased risk of devastating conditions like heart disease, stroke, diabetes, severe infections, and even cognitive decline such as dementia. These aren't theoretical risks. They are very real, very common, and often tragically overlooked. The truth is, maintaining proper hygiene as you age isn't about vanity. It's about survival. It's about catching early warning signs before they escalate into major health crises. It's about giving yourself the best possible chance to enjoy your golden years with strength, dignity, and peace of mind. In the next few minutes, you're going to uncover the 7 most dangerous hygiene mistakes that seniors unknowingly make. And most importantly, you'll learn exactly what you can start doing today to avoid these pitfalls. The information I'm about to share is backed by hard science, real-world patient stories, and proven medical insights. No fluff, no scare tactics. Just critical knowledge that could save your life or the life of someone you love. Before we begin, if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you enjoy this video, please type 1 in the comments. If you don't like it, type 0 in the comments to let me know so I can make better videos for you. Now let's get started. Mistake 1. Neglecting oral hygiene. When was the last time you truly examined your toothbrush? Is it frayed, worn down, or older than 3 months? Have you noticed the bristles no longer seem as effective as they once did? Are you brushing thoroughly twice a day, or has your routine become rushed and inconsistent as life gets busier? More importantly, did you know that maintaining proper oral hygiene is about far more than just keeping your teeth clean or your breath fresh? It's critical for your overall health and longevity. Extensive research from institutions like Harvard Medical School has shown that poor dental care is directly linked to a higher risk of developing serious conditions such as heart disease, stroke, and even cognitive decline, including dementia. The connection might not be obvious at first, but the reality is that bacteria from untreated gum disease can travel directly into the bloodstream, where it can trigger widespread inflammation and result in devastating, sometimes life-threatening conditions. Studies have demonstrated that seniors with poor oral hygiene are nearly 3 times more likely to develop cardiovascular issues than those who maintain good dental care. This isn't just some abstract academic theory. It has real-world consequences. Take the story of Eleanor, a 70-year-old retired librarian from Vermont. Eleanor always thought her dental routine was good enough. She brushed once a day and didn't pay much attention to her bleeding gums, dismissing it as part of getting older. It's just what happens as you age, she thought. But during a routine physical exam, her doctor noticed subtle signs of systemic inflammation and suggested further tests. To Eleanor's shock, she was diagnosed with early-stage endocarditis, a dangerous infection of the heart's inner lining that was linked directly to bacteria entering her bloodstream from untreated gum disease. The doctor explained that, had they discovered it just a few months later, the damage to her heart valves could have been irreversible, leading to serious and life-threatening complications. Eleanor's experience is a sobering reminder that what may seem like a small oversight, such as ignoring gum health, can silently escalate into a grave health issue without any noticeable symptoms until it's too late. So what can you do right now to protect yourself or your loved ones? First, take a moment to inspect your toothbrush. If it's older than 3 months or shows signs of wear and tear, replace it immediately. Ideally, make the switch to a high-quality electric toothbrush. Studies from the University of Pennsylvania School of Dental Medicine have shown that electric toothbrushes can remove up to 62% more plaque than manual brushing, significantly improving your oral health. Make brushing a ritual, not just a quick, distracted chore. Brush twice a day for a full 2 minutes each time. If you're not sure you're brushing long enough, Set a timer to make sure you're giving your teeth the time and attention they need. Don't just brush but floss every night without exception, even if your gums bleed initially. Consistent, gentle flossing will strengthen them over time. Flossing is one of the most effective ways to remove food particles and bacteria from hard-to-reach areas that your toothbrush might miss. Don't skip your dental checkups. Even if you wear full or partial dentures, regular visits to the dentist can help detect early signs of infections, lesions, or even more serious health issues that you might not notice otherwise. Pay attention to any signs of bleeding, swelling, or tenderness in your gums. These are not harmless signs of aging. They are warning signals from your body that something could be seriously wrong. Ignoring these signals might feel easier in the short term, but the consequences of doing so could be much more severe down the road. Responding to them with consistent, careful oral care can prevent potential life-threatening conditions and help preserve your independence, vitality, and overall quality of life. So, take control of your oral health today. Don't let a small oversight become a health crisis tomorrow. Your future self will thank you for it. Mistake 2. Infrequent bathing and skin care. How often are you truly bathing and caring for your skin? Be honest with yourself. As we age, it's common for many seniors to bathe less frequently, whether due to decreased mobility, a fear of slipping, or simply the belief that bathing isn't as necessary. These habits often evolve over time. However, what many people don't realize is that the skin, our body's largest organ, serves as a vital warning system for internal health problems. Dermatologists at the Mayo Clinic have consistently emphasized that reduced bathing and inadequate skin care in older adults can easily obscure the early signs of serious conditions such as diabetes, liver disease, kidney problems, and even heart failure. Their research and clinical studies have shown that nearly 40% of undiagnosed medical conditions in elderly patients could have been detected much earlier through attentive observation of skin changes alone. Let me tell you the story of Leonard, a 74-year-old retired high school coach from Ohio. Leonard had always considered himself healthy and active. He had a busy life, full of activities, and kept his routine simple. As he aged, however, he started bathing only once a week, particularly during the colder months, believing that it would protect his skin from drying out. "I thought I was doing the right thing," Leonard explained. "I was trying to keep the natural oils in my skin." But as Leonard reduced his bathing, he wasn't paying attention to the changes in his body that were becoming more visible. During a routine checkup, his doctor noticed patches of discoloration and unusual dryness on Leonard's lower legs, signs that Leonard himself had dismissed as nothing serious. His doctor, concerned by these observations, ordered further tests, which revealed that Leonard was in the early stages of liver disease. The condition, if left undiagnosed much longer, could have led to severe complications such as liver failure. Leonard was shocked because he had assumed the problem was just a harmless part of getting older. It wasn't that Leonard's hygiene was poor. Rather, it was the fact that his infrequent bathing and skincare habits had allowed these crucial visual clues to remain hidden for months. His lack of regular skin inspections kept him from identifying these early warning signs, potentially costing him the chance for earlier, more effective treatment. This story serves as a powerful reminder that proper hygiene and skincare are more than just about feeling clean or looking presentable. They are essential to recognizing and preventing serious health issues. So, how do you avoid making the same mistake as Leonard? The solution lies in establishing a consistent bathing schedule. Ideally, you should aim to bathe at least 3 times a week, even if you aren't particularly active or sweating heavily. Regular bathing ensures you can spot potential health issues early, while also maintaining overall hygiene. It doesn't need to be a strenuous or long process, but it's important to use a gentle, fragrance-free cleanser that won't strip your skin of its natural oils. Harsh soaps or cleansers can cause more harm than good, especially as we age. After bathing, moisturize immediately while your skin is still slightly damp to lock in moisture and prevent drying, which can exacerbate skin conditions and make it harder to detect abnormalities. Perhaps most importantly, make it a habit to regularly examine your skin, under good lighting and in a comfortable setting. Check for any new spots, persistent dryness, flaky patches, discoloration, rashes, or areas that itch or feel unusually tender. These aren't just cosmetic issues. They could be the first visible signs that your body is trying to communicate deeper health concerns. Our skin is often a reflection of our overall health, and neglecting it can cause important signs to go unnoticed. If you see anything suspicious, don't wait to consult with a medical professional. Early detection of underlying health conditions is key to better outcomes, and regular skin checks allow you to catch life-threatening diseases in their earliest, most treatable stages. Remember, maintaining regular bathing and careful skin care isn't just about staying clean or looking good. It's a powerful life-saving act of vigilance. It could be the difference between catching a disease early enough to treat it successfully and facing severe, irreversible health problems. Your skin isn't just a barrier. It's a reflection of your body's internal state, and when you take the time to care for it properly, you're investing in your health, your safety, and your future. Don't let something as simple as a regular bathing routine slip through the cracks. Your health and well-being depend on it. Mistake 3. Ignoring nail care. When was the last time you took a careful look at your fingernails and toenails, not just a casual glance, but a real inspection? Are they trimmed neatly, clean underneath, and free from any strange discoloration, thickening, or brittleness? If you're like many seniors, nail care might not seem like a top priority. But here's the truth. Your nails are powerful indicators of what's happening inside your body. According to the American Academy of Dermatology, changes in the nails can signal over 20 different systemic health issues, including anemia, diabetes, thyroid disease, lung problems, and even heart failure. In fact, research shows that in adults over the age of 65, nail abnormalities led to the early detection of serious internal illnesses in nearly 1/3 of cases, often making the difference between early treatment and dangerous complications. Unfortunately, too many seniors dismiss nail problems as just another normal part of aging. Take the story of Eleanor, a 79-year-old retired librarian from Maine. Eleanor had noticed her toenails becoming thicker, more yellowed, and oddly misshapen over several months. Embarrassed by the changes, she simply stopped wearing sandals and convinced herself it was nothing more than cosmetic aging. "I figured ugly nails just came with the territory," she recalled. But when she began experiencing sharp pain in her foot and difficulty walking, she finally went to see a podiatrist. The examination quickly revealed a long-standing fungal infection. But that wasn't all. Further blood work uncovered that Eleanor's immune system was severely weakened due to previously undiagnosed type 2 diabetes. Had she waited much longer, she could have faced serious infections that might have led to hospitalization or even amputation. Her seemingly minor nail issue had been a flashing red warning light all along, and she hadn't even realized it. So what steps should you take right now to avoid a similar mistake? First, establish a consistent nail care routine. Trim your nails regularly, straight across with slightly rounded corners, to help prevent painful ingrown nails. Keep your nails clean and dry and avoid overly aggressive trimming, which can cause small wounds that become easy entry points for infection. Always wear breathable shoes that allow air circulation and change your socks every day to keep your feet dry and healthy. Use a gentle moisturizer on your nails and cuticles to prevent cracking and dryness, but be careful not to trap moisture under the nails, which can encourage fungal growth. Most importantly, stay vigilant. Any unusual thickening, color changes, such as yellow, brown, or bluish tones, brittleness, ridging, lifting of the nail from the nail bed, or pain around your nails should not be ignored or brushed off as just getting older. These changes are often your body's way of sounding an early alarm, a silent cry for attention that could be pointing to much more serious health problems brewing under the surface. Your nails are not just decorative, they are diagnostic tools, offering you a unique glimpse into your internal health if you know how to listen. Are you paying attention, or are you dismissing the signs until it's too late? The choice and the consequences are yours. Mistake 4. Improper incontinence management. When it comes to personal hygiene, one of the most commonly overlooked and misunderstood issues among seniors is incontinence. Surprisingly, over 50% of older adults silently struggle with some form of incontinence, whether it's urinary or fecal. What's even more shocking is how many people hide this condition, either out of embarrassment or the misconception that it's just an inevitable part of aging. The reality, however, is far more serious. Leading experts, such as urologists from Johns Hopkins Medicine, have consistently found that untreated incontinence can cause a range of devastating complications. These can include dangerous skin infections, falls, from the urgency and discomfort, social isolation, and even mask the presence of more severe conditions such as bladder or prostate cancer. Research shows that seniors who actively manage their incontinence have a 60% lower risk of experiencing serious complications compared to those who try to cope on their own. Let me tell you about Roger, a 73-year-old retired accountant from Arizona, who unknowingly put his life at risk by neglecting the issue. Roger had been dealing with occasional leakage for months but was too embarrassed to talk to his doctor. Instead, he relied on makeshift solutions like using paper towels and frequently changing his clothes. "I thought I could manage it on my own," Roger admitted, but the problem just kept getting worse. It wasn't until he developed painful skin sores and was forced to seek medical help that doctors discovered an advanced prostate condition. This condition could have been diagnosed months earlier if Roger had sought proper medical care sooner, when it was more treatable. In fact, had he addressed it early on, he could have avoided the painful consequences he faced later. Roger reflects on his experience. "I was too proud to talk about it. I wish I'd spoken to my doctor at the first sign of the problem, rather than trying to hide it and struggle through." His story is a cautionary tale, one that underscores the importance of seeking help early. If you're dealing with incontinence, it's crucial to act promptly, not just for your dignity, but for your health. So, what can you do right now if you're experiencing any form of incontinence? The first step is to talk to your doctor. Don't be embarrassed. This is a common issue that healthcare professionals deal with every day. They can offer solutions, treatments, and strategies that can help you manage the problem effectively. Avoid makeshift solutions like paper towels or regular pads. Instead, use absorbent products specifically designed for incontinence. Change them promptly when wet, and follow a proper cleansing routine to prevent skin breakdown or irritation. Most importantly, recognize that incontinence is not a normal part of aging. It's often a symptom that there is something else going on in your body that needs medical attention. Whether it's a bladder infection, a prostate condition, or another serious issue, addressing it early can make a world of difference in your long-term health. Are you experiencing occasional leakage? Do you find yourself planning outings around bathroom availability or using makeshift protection? These aren't problems you should ignore. Don't wait another day to speak with your doctor. Your health and your quality of life may depend on it. Mistake 5. Ear hygiene errors. When it comes to maintaining hygiene, many people often overlook the importance of proper ear care, a mistake that can lead to painful and damaging consequences. How often do you clean your ears, and how do you do it? Be honest with yourself. Are you using cotton swabs to clean your ears, pushing them deep into the ear canal? If so, you're not alone, but you're also making a potentially dangerous mistake. This practice is more common than you might think, especially among older adults. Improper ear cleaning doesn't just put you at risk of damaging your hearing. It can also cause severe infections that, with the right precautions, could have been entirely avoided. Otolaryngologists, ear, nose, and throat specialists, consistently warn that improper ear cleaning is responsible for nearly 40% of ear canal injuries in patients over 65. Many of these injuries lead to infections, some of which could have been easily prevented if proper ear hygiene techniques were followed. Let me share the story of Patricia, a 71-year-old retired librarian from Washington. Patricia had been cleaning her ears with cotton swabs for years, gently pushing them deep inside the ear canal to remove earwax, as many people do. She thought this was the best way to keep her ears clean and never questioned it. But one day her routine went horribly wrong. While cleaning her ear, she accidentally punctured her eardrum, leading to a severe and painful infection that spread to nearby tissues. "I had always cleaned my ears this way," Patricia explained. "No one ever told me it was dangerous." At first the pain was minor, but over time it worsened, and she soon experienced severe discomfort and even hearing loss. After seeking medical treatment, Patricia required emergency intervention to address the infection, which ultimately resulted in permanent hearing damage. The damage to her eardrum and hearing could have been avoided completely had she followed safer ear hygiene practices. It's a stark reminder that something as seemingly innocent as ear cleaning can have serious consequences when done incorrectly. So, what's the right way to care for your ears? It's actually simpler than you might think, and by following a few easy guidelines, you can protect your hearing and prevent infections. The most important rule to remember is this: never insert anything smaller than your elbow into your ear canal. This means no cotton swabs, hairpins, or other small objects. Your ear canal is a delicate and sensitive area, and inserting objects into it can cause damage that leads to infections, injuries, or even hearing loss. Instead, clean only the outer ear with a warm, damp washcloth. This is the safest and most effective way to remove dirt and debris without putting yourself at risk. If you feel like you have excess earwax, avoid using cotton swabs to remove it. Instead, use ear drops that are specifically designed to soften wax. There are many over-the-counter options available that can help with this, but it's important to follow the instructions on the packaging carefully. If you find that the earwax isn't coming out, or that you're experiencing discomfort, consult a doctor instead of attempting to remove it yourself. Additionally, if you experience any pain, discharge, or changes in your hearing, such as a feeling of fullness, muffled sounds, or difficulty hearing, don't hesitate to seek medical advice immediately. These symptoms could be signs of a serious underlying condition, such as an ear infection or eardrum rupture that requires prompt treatment. Ignoring these signs can lead to more severe problems down the road, including long-term hearing loss. The earlier you address an issue, the better your chances of preventing permanent damage. Are your ears feeling itchy, blocked, or do you notice unexplained changes in your hearing? These symptoms are not something to brush off or try to fix on your own. They may indicate a need for professional care, and attempting to resolve them yourself with unsafe methods could only make things worse. Your hearing is precious. It's a sense that connects you to the world, and it's vital to protect it. Don't risk long-term damage by using improper cleaning methods. Always be mindful of your ear health, and don't hesitate to consult a medical professional if you're unsure or if you notice anything unusual. Your hearing will thank you for it. Remember, ear hygiene is not just about keeping your ears clean. It's about preserving your hearing and overall health. By following proper ear care practices, you can prevent infections, preserve your hearing, and enjoy a higher quality of life. Don't risk damaging your ears with improper techniques. Be proactive about your ear health and seek medical help if necessary. By doing so, you'll ensure that your hearing stays sharp and clear for years to come. Mistake 6. Poor foot hygiene. When was the last time you took a good close look at your feet? Not just a quick glance while getting dressed or before putting on shoes, but a thorough inspection, looking between your toes, checking your heels, and assessing the soles. It's easy to overlook foot care, especially as we age. After all, our feet tend to be out of sight, and we assume that little issues like dry skin, minor cuts, or even calluses are just signs of getting older. However, what many people don't realize is that your feet are one of the most important indicators of your overall health. Doctors, especially podiatrists specializing in geriatric care, often begin their examinations by carefully inspecting their patients' feet because they can reveal early signs of circulatory, nervous, or metabolic issues. Conditions such as diabetes, neuropathy, and vascular disease often manifest first in the feet, making foot health a critical part of your overall wellness. According to the American Podiatric Medical Association, up to 85% of diabetes-related amputations could be prevented with proper foot care and regular inspections. Yes, you read that correctly, 85%. This staggering statistic shows how important it is to take proactive steps in caring for your feet, especially as you age. The good news is that with simple and consistent foot hygiene, these serious health complications can be avoided altogether. Take the story of Raymond, a 76-year-old retired factory worker from Illinois. For years, Raymond ignored minor cuts, cracks, and dryness on his feet, assuming it was just a normal part of getting older. "My feet had been looking rough for years," he admitted, dismissing the issues as nothing more than the natural wear and tear of aging. However, during a routine checkup, his doctor noticed these foot problems and immediately ordered tests for diabetes. The results revealed that Raymond had early-stage diabetes, a condition that, had it gone undiagnosed, could have caused severe complications later on. Thanks to his doctor's careful examination and attention to his feet, Raymond was able to make crucial lifestyle changes before the disease progressed to a point where it might have caused irreversible damage. "If my doctor hadn't checked my feet, I might have gone years without knowing I had diabetes," Raymond said. "By then, the damage could have been severe." This story highlights how vital it is to pay attention to your feet. Small issues like a blister, callus, or minor cut could be the first signs of something more serious, especially if they aren't healing as they should. Left unchecked, these seemingly trivial foot problems could lead to major complications that affect your health, mobility, and quality of life. Raymond's experience is a powerful reminder that taking the time to care for your feet today can prevent major health crises tomorrow. So, what can you do today to protect your feet and by extension your overall health? First and foremost, it's essential to wash and thoroughly dry your feet every day, paying special attention to the areas between your toes. Moisture can easily get trapped in these spaces, leading to fungal infections, so make sure you dry your feet thoroughly after each wash. If you have diabetes or any circulatory issues, this is even more important, as your feet may be more susceptible to infections and sores. Regularly inspect your feet for any cuts, blisters, sores, discoloration, or changes in temperature. Even if something looks minor, don't ignore it. What seems like a small issue could be the first clue of a much bigger problem. Next, wear clean, dry socks made from natural fibers or moisture-wicking materials like cotton or wool. These materials help keep your feet dry and reduce the risk of fungal infections. Change your socks daily, especially if you sweat a lot, and always wear socks that fit well to avoid pressure points that could lead to blisters or sores. It's also important to wear shoes that fit properly, providing adequate support. Tight shoes, or those that don't allow your feet to breathe, can cause blisters, calluses, or worse, leading to chronic foot problems. Another crucial part of foot care is moisturizing your feet. Dry, cracked skin is not just unsightly, it can also lead to painful fissures and increase your risk of infection. Apply a gentle, fragrance-free moisturizer to the tops and bottoms of your feet and heels, but avoid moisturizing between your toes. Over-moisturizing in these areas can create a breeding ground for bacteria and fungi, so it's important to keep those areas dry. If you notice any pain, numbness, or wounds that don't heal, don't wait to seek medical advice. These could be signs of neuropathy, nerve damage, or poor circulation, both of which require immediate medical attention to prevent further complications. Are your feet feeling dry, cracked, or uncomfortable? Have you noticed any cuts that won't heal or any changes in the color of your feet, such as redness, blueness, or a loss of feeling? These are not just cosmetic issues. They could be early warning signs of serious conditions such as diabetes, neuropathy, or circulation problems. These health concerns need to be addressed as soon as possible to prevent more serious outcomes like infections, ulcers, or even amputations. Don't ignore these signals from your body. The earlier you catch a problem, the easier it will be to treat, and the more likely you are to preserve your mobility and independence. Foot care isn't just about looking good, it's about maintaining your health and well-being. Your feet are the foundation of your body, and when they're healthy, you can stay active, mobile, and independent for many years. Neglecting your feet, on the other hand, can lead to chronic pain, infections, and even life-altering conditions. By making foot care a regular part of your routine, you're investing in your future health and quality of life. So, take a few minutes today to care for your feet. Inspect them, clean them, moisturize them, and seek medical attention if you notice any issues. Your feet deserve the same level of care and attention that you give the rest of your body. After all, they carry you through life, so don't let them carry the weight of preventable health issues. Mistake 7. Medication-related hygiene issues. Do you take multiple medications? Have you noticed changes in your body odor, sweating patterns, or even dry mouth since starting them? What if I told you that the medications keeping you alive might be causing hygiene problems that signal more serious side effects? Many seniors unknowingly experience changes in their personal hygiene as a result of the medications they take, which could indicate potentially dangerous drug interactions or side effects. Pharmacologists from the American Geriatric Society have extensively documented how certain commonly prescribed medications can lead to dry mouth, excessive sweating, and even changes in body odor, signs of toxicity or other serious health issues. In fact, their research shows that nearly 40% of adverse drug reactions in seniors initially present as changes in personal hygiene, often before more severe symptoms appear. Take Barbara, a 67-year-old retired nurse from Florida, as an example. For weeks, Barbara's family dismissed her unusual body odor as simply a sign of poor hygiene. However, during a routine checkup, her geriatrician quickly recognized the smell as a sign of medication toxicity, which was slowly damaging her liver. "I was showering regularly and using deodorant," Barbara explained. "I had no idea the smell was coming from inside my body, not from a lack of cleanliness." What Barbara didn't realize was that some of the medications she was taking were altering her body chemistry. causing the unusual odor that pointed to a more serious issue. So what can you do to protect yourself from medication-related hygiene problems? Start by tracking any changes in your hygiene after starting a new medication. Keep a simple journal where you can note differences in body odor, sweating, mouth dryness, or skin changes. Stay properly hydrated unless your doctor has given you specific instructions otherwise, as dehydration can worsen some medication-related side effects. If you notice any unusual sweating or changes in your body odor, don't ignore them. Report these changes to your doctor immediately. These symptoms could be early warning signs of dangerous drug interactions or side effects that need medical attention. And remember, never adjust your medication dosages on your own, even if you suspect your meds are causing hygiene issues. Always consult with your doctor before making any changes. Have you noticed any unusual body odor despite regular bathing? Is your sweating excessive, or do you experience extreme mouth dryness? Don't brush these symptoms off as just normal aging. These could be signs of medication-related issues that need urgent attention. Your health, and possibly your life, depends on recognizing these early warning signs and getting the right treatment before things escalate. Every single mistake we've covered today might seem small at first glance. Skipping a dental appointment, bathing less often, ignoring foot care, or using a cotton swab just once. But these small actions, or inactions, can set off a chain reaction inside your body that leads to devastating consequences. Too often, seniors dismiss these hygiene changes as a natural part of getting older, but they aren't. They're warning signs, signals that something deeper might be going wrong beneath the surface. And here's the most important thing you need to know. It's never too late to take control, change your habits, and protect your health. Your future independence, your ability to enjoy life, and even your longevity all hinge on the decisions you make today. The good news is that you have the power to make positive changes right now. It starts with awareness and action. Go back through each of the points we covered today. Take a hard, honest look at your daily routines, habits, and hygiene practices. Are there areas where you can improve? Are there things you've been overlooking or neglecting that could be a sign of something more serious? The time to make changes is now. Don't wait until it's too late. Small, consistent changes today can prevent big, life-altering tragedies tomorrow. Your health is in your hands, starting right now. Your future is worth it. Take action to protect it.